African American Children, Family, and
Dr.
Research
Smith.
Center Conference. We welcome you so much, and thank you for joining this session.
Greetings, everyone. So excited to be here. If you're just leaving the panel discussion, I think we're all energized and enthused, and hopefully we can keep that momentum up. So I am Nina Smith, and I serve as a co-investigator at the National African American Child and Family Research Center. And this session centers around poverty alleviation and the role of temporary assistance for needy families. And I'm so excited to have Naya Kelly here with us today. Her presentation is titled Authentic Collaboration, Public Benefits, Participatory Research, and Advocacy. At this time, I will turn it over to Naya.
Hi, my video will not come on. It looks like the host turned off my video in the regular room, and so I am unable to start my video here. I'm getting a message stating that I cannot start video because the host has stopped it. So
one second, Ms.
Okay.
Kelly, can I bless? Give me 1 second, okay?
Yeah, no problem.
Ms. Kelly, I do apologize for the inconvenience. If you could go ahead and begin your discussion, I will make sure
Okay.
that the moderator comes in and...
Okay, yeah, that's not a problem. Thank you all so much for having us here today. I'll start by introducing myself. My name is Naya Kelly. Pronouns are she, her, hers, and I am the Director of State Legislative Policy, Equity, and Transformation at the Chicago Coalition for the Homeless here in Illinois. I'm also joined by Mexica Williams, who is a member of our grassroots leaders, and I'll let Mexica, if you want to just introduce yourself.
Good afternoon, everyone. I'm Mexica Williams. Pronouns she, her, hers. I am a grassroots leader with the Chicago Coalition for the Homeless, as well as a RAB TANF participant for the RAB group, as well as a board member for the Chicago Coalition for the Homeless and a TANF recipient.
And thank you so much, Mexica. And we want to thank you all for having us here today and for joining us in our breakout session. So we are going to be talking about temporary assistance for needy families today, as well as the work that we have been doing on what is called our Research Advisory Board, which is a participatory research opportunity that CCH, along with Heartland Alliance, which is an international organization that has a research arm, has been working on since 2019. I want to start today we wanted to start today by lifting up a couple of our members that we have lost in the time that we've been working on this project, both staff members as well as Research Advisory Board members. And so we're just going to take a second to lift up Keith, Miss Leanna, and Miss Edrika, who we lost unexpectedly in the last 6 months due to various circumstances. So if you all don't mind, we're just going to take about 30 seconds in remembrance of them. Thank you. So as I said, we're over at the Chicago Coalition for the Homeless, and we'll start by just giving a little history of the work that we've been doing and how we started working on projects that deal with economic as well as public benefits in the world of talking about housing insecurity as well as homelessness. So CCH is a 40-year-old organization, 42 years old at this point, old organization. We started out as an organization saying housing is a human right, that we're not going to end homelessness by piecemealing, creating shelters or doing one things, that we have a responsibility to do systemic change through advocacy, and that's both through doing community organizing, and so talking to folks who have lived experience and bringing them to the table, through our law project, where we do direct legal representation through when it comes to education rights, public benefits. Illinois has a Bill of Rights for people experiencing homelessness, and so using that as a way to file class actions, and then through our advocacy arm or policy arm, where my responsibility is to go down to our state capitol and advocate for, oh, I can start my video. Awesome. Hi. So through, it's weird. Okay. All right. And so in this work, I get the opportunity to go down to Springfield to work not only on our state budget, but as well as creating legislation that removes barriers for people who are experiencing homelessness. In that work, it has led us to start thinking about public benefits. We don't believe that people are one-issue people. Someone is experiencing homelessness doesn't mean that they're not experiencing economic hardships. It doesn't mean that they're not dealing with re-entry issues if they've experienced incarceration. It doesn't mean that there aren't educational barriers for themselves and for their children. And so our work is not just dealing with that, like I said, just with housing or housing insecurity or homelessness. And so a couple of years ago, we got really deep into this work by thinking about public benefits within the college space. And that took us to creating focus groups and talking to people who are recipients of public benefits. Exactly, we don't live in silos. And so that work led us to talking about some of the barriers that folks who receive TANF, what are the things that they're seeing boots on the ground? We know that, temporary assistance for needy families is a program that came out of the destruction of public benefits in this country in 1996. Some call it reform. Myself, I call it the destruction. And do so because if you look at the numbers of folks who were thrown off of the public benefits role and how poverty has not been eradicated in the last 26 years through this program, that's where, words mean things. And I think we have to call a thing a thing. And so that has led us to, in those focus groups, hearing about TANF is not enough. Despite Illinois getting $1 billion in TANF funds, so we get about $500 million from the feds, 500 million from the feds, and we have to meet that with an additional 500 million for maintenance of effort. We have $1 billion that we would get, we have an opportunity to spend on TANF related projects. We spend 4% of that on providing cash assistance to families. 4%. So 40 million of that 1 billion goes out of the door in cash assistance to families, despite the name of the program being temporary assistance for needy families. And so with that, one of the things folks said was like, it's not enough. So at that time, I believe it had been pegged at 24% of FPL. For that last, I think at that point, it was like 13 years, it had been at 24%. You have inflation, you have the cost of living going up, and nothing was changing for this. And so one of the things that we did was raise the cash grant amount to 30% of FPL, and so that every year in October, that for looking back at what FPL is and raising the grant amount. Our goal at that point was to get it to 50%, but our state legislature said we could not afford it. And when we talk about budgets, we talk about them being moral documents. And if we say that we cannot afford this, but we can afford to spend money on every other kind of project that you can think of, it's us saying that we do not value these people. But we were able to get it up to 30%. So for a family of 3 right now, a mother or a father and their 2 children, they're receiving $549 here in Illinois. Each state has their own policies and procedures, and the federal government permits us to be able to set boundaries or barriers in people's way of receiving this money. We often look at states like Mississippi and we say, oh, they're doing this, and they're like, there are not a lot of people who are receiving TANF in those states. But then you look at states like Vermont, looking at Washington State, and you're seeing that their programs are more robust, and the cash grant amount is much more than you would say in states where there are predominantly Black and brown people living. And so we get to make our own conclusions on why that's the case. I'm sure people can name it. We're here in this space. But that's the work that, that's the foundation of some of the work that we've been doing. We also worked on sanctions. We were hearing from families that they were being sanctioned no matter, there was no one who didn't have a story of saying, I have had my grant turned off. Because I didn't do this, or the person didn't get this, or the local office didn't have this information, benefits turned off. So for families who are using this money to meet their basic needs, and it's not even meeting their basic needs, we're getting their cash grant turned off. We looked at other states that the federal government requires sanctions to happen. And so there are unique ways in which to get around that. So what we said here in Illinois, it said that the temporary assistance for needy families is supposed to be for children. And so one of the things that we said is like 75% of this grant should belong to the children. It should be untouchable for sanctions. If you are saying that someone did something wrong, which when you're experiencing poverty, one bus arriving early or arriving late can turn your world upside down. Should not say that this family should not receive their benefits. And so 75% of the grant belongs to the child, 25% belongs to the parent, and you're only permitted to sanction a small, like 33% of that. So 75% belongs to the child, 25% belongs to the parent. And if they want to sanction, they can only sanction this like a third of that 25%. Again, that money could be the world for families, but it's a much smaller amount than what we were seeing before of the sanctions. Some folks feel like, carrot or the stick. If we want people to do things, we need to have a stick. When people are living in poverty, there's enough sticks. Like, we don't have to create new barriers for people for them to be able to attempt to survive. The last thing that we worked on was around our felony drug convictions. Again, 1996, they said that if you have a drug felony conviction on your background, then you are barred from receiving TANF. So you have paid your debt to society. You come back out, you get your children back if your children have been placed into the system or they're living with relatives, but you're not permitted to receive a public benefit, a cash benefit, because this idea that you will use it to do X, Y, and Z, this idea of what this person is or who they are now. We had the opportunity here in Illinois to be able to remove that felony drug conviction. And so with those 3 pieces of legislation that we've worked on around TANF, we are attempting to get the roles of TANF back up, that in making sure that people who qualify are actually applying. But what we're finding out is that there are a lot of people who qualify but do not apply. And so that came into thinking about advocacy. Like, what the question that we came up with is, there are people who are living in abject poverty, who are struggling day to day, who could apply for TANF. Why are they not doing it? We had heard things in our focus groups that we were having, but we wanted to do it on a much larger scale and take it out of the folks that we worked with. Keith, who I mentioned at the top of this, was our community organizer who worked with families. We were meeting with families, but we knew that there were folks that we were not reaching. And so this opportunity came about of creating a research advisory board through one of our funders, along with Heartland Alliance. And from that, we put this project together. We said we want to hear from folks. And we not only want to hear from them, but they may not come to us, but they talk to people who are in their communities. And so the creation of this, of putting this together, was a funder said, we're interested in this. Heartland Alliance said that they would be interested in doing the research component. CCH said we were interested in bringing folks to the table and doing some of that, historical, doing a historical download with people with lived experience. And we put this together. And so with that, I want to open it up a little to talk with Maxica. We're just going to have a discussion. And if you have questions, please throw them into the chat. I hope that we answer a lot of your questions through our conversation that we're going to have. So if Maxica, if you want to come back off of mute and turn on your video.
It's not allowing me to. It actually disabled me.
Okay. And so I'm assuming fix that in a second. But as we're waiting on that, why do you think it was important to include people with lived experience in this work?
Okay, there's my video. Thank you.
Okay.
I think it's important to include people with lived experience because they're the experts on the work. They're the expert on the issue, and how they're the reason and the way to the issues, the barriers that lead to homelessness, that lead to those individuals not applying for TANF benefits. It'll help you to find all of those issues without you having to search for very far. And when people with lived experience are brought to the table, it brings a unique point of view to the table that's essential in you getting the work done and processing the work. And it also alleviates steps. When you put the people with lived experience at the table, you're alleviating, I'm going to go look for this focus, do this focus group. I'm going to go do this and have to do 5, 6, 7 of them. You have those people at the table already, and they can hash out some of the issues and risks that come along the way with you and develop a great, excellent plan. And I think those with lived experience, whether it's good or bad, as you stated before, when people get incarcerated, they couldn't get their benefits, they still need to be at the table. And as you said, they did their time. So why should they be persecuted and have to do more time and be eliminated from being able to have those benefits? And having them at the table, you can find out reasons why it's an issue for them, reason why it's an issue for mothers with 3, 4 kids or a set of twins that can't find childcare. You're finding reasonings and the issues right there in one set table with them sitting with you to go through the rules and changes.
Yeah, thank you, Maxica. So thinking about why you decided to be a part of this project, tell us a little bit about that.
I decided to be a part of this process because I always had issues with TANF and I never really had a way to get help with it. And I had to become my own little savvy research person and, to navigate through those things. And I always felt like I should have had somebody else to support to go through it. And it was important to know to me, because I thought like I was the only one, to know that there were other women in the room and this was happening to them. It was fathers in the room. This was happening to them as well. And they had custody of their kids trying to get TANF, or they didn't apply for TANF because they were like, so many myths and conceptions about TANF. Just kind of knowing that there's more people in the room that knew about it or felt the way that I felt and had heard these myths. And these myths and beliefs were the barriers. And we come together and talking about it, that's what made me want to be a part of the work. And to know that I can real change for not just myself and my children, but also for other individuals in the state of Illinois.
And yeah, and I should also say that Mexica has had several opportunities to testify down in Springfield on this issue. She was one of the driving forces for us to be able to get us up to 30%. And we'll talk a little bit more about the work that we're doing right now here in I believe that TANF needs to be destroyed, but and thinking about that and trying to make it better in the situation that we're at right now, we'll talk a little bit more about some of the work that we're doing a little bit later on. So Mexica, another question. How long have you been working on the project?
When you were talking briefly about it, we started doing the focus groups for the TANF Coin Act and 2007 through 2018. And we were able to, I testified in spring of 2018 for the TANF Coin Act. And it was passed and stated into law in the state of Illinois in October 2018, which is a great victory. It's a little and it's a step forward, but we still have more work to do. And then we also started the RAP in about 2020, just as the pandemic was starting. And we've been working on the RAP project since then. So for me, it's been a little over 4 or 5 years, but for the RAP project itself, I worked on it for the last 2 years consecutively.
Yeah, I remember the day, like, so we met in February for our inaugural event in February of 2020. And we were like, okay, we'll see each other in another couple of weeks. And that survey said that was a lie. But so switch over to doing this via Zoom and, you know, and had to shift the way that we were planning on doing this project. What was the impact of COVID on this work?
The impact of COVID, it made us shift in so many directions. We went to meeting on Zoom. I had never worked on Zoom and none of the other ladies either. I fidgeted a little bit with school on Google Teams, and but this right here, Zoom, was a whole nother platform. We didn't even know that we could correlate and work together on a Zoom meeting. We assumed we had to do all of this work in the office. It made it hard until we learned, you know, week after week, month after month, and then it became 2 years later, how to match up these meetings with everybody's schedules and get as much information done in the process. And mind you, we also did the interviews for the TANF recipients or those individuals getting ready to apply for TANF via Zoom in another technology platform, which was different. But so it showed us we can do work outside the office.
Right. So tell me, so you just talked about the interviews that you all did. Tell me, let's back up a little bit. So you all had to create questions. And we're working with a research arm of an organization that isn't just like this small group. They are in this work in a way that they all went to school to do quantitative and qualitative data research. Coming into that space, like, tell me a little bit, or tell us a little bit about that process.
Once again, it was something I didn't know about. And at first I was intimidated by it. I'm like, well, you know what? I'm gonna struggle right here because I don't know anything about this. And I don't think I have much input. And I just kind of sat back, listened. Because like I said, I like to collect information and that's how I process things. And they made it simple and easy. They would send us these packets with some of the detailed steps before the meeting to help us before the meeting. And that did help me. But it was very intimidating. I'm like, well, how do I get this data? How do I get these numbers? And why am I doing this data? And what are these numbers? What does all of this mean? And they carefully went through it. And if we didn't understand something, they allowed us to have a judgment-free area. And we were able to get the information we needed to help us learn and understand the processes and why the work was so important to get the data, the information, put it into codes, and what codes mean and how we can use the codes to make different changes in the laws and the barriers that keep people from receiving TANF.
Yeah. Of the things that you all were hearing from people so you all are conducting interviews with recipients. So you all were doing outreach in your own communities as well as like trying to get things out on social media. When you all sat down with people, what were some of the things, like what were some of the questions you all were asking, and what is some of the information that you all were receiving back?
And the information that we asked were simple questions like, what did you hear about TANF before you applied, or what did you know about it? What was the process of TANF for you like? We wanted to know everything from what you smelled there, from what you saw there, the way the person's demeanor was, were they respectful, were they nice, kind, how many hours that you had to allot to this, how many hours were you in the office, how many hours were you on a phone call once it switched over to the pandemic, because some people were just applying during the pandemic. What made you want to apply? Was it easy to apply? Did you have any issues to apply? Were you able to get on that phone call? Did you have a phone to make the phone call? Just kind of, like I said, hashing out those issues and barriers with the people while we had them for that short amount of time.
Yeah, and so I know you said that it was like difficult to switch from doing the stuff in person to on Zoom, but thinking about the positives, like what are some of the positive things that came out of you being involved in the Research Advisory Board?
A lot of the positives is the experience that I gained and the fact that I was able to make a connection with the individuals we did the interviews with, and a connection with the ladies on the team. They became not just colleagues and friends, but they became family to me, you know, after working with people for 2 years. And it showed when we had the loss of Keith Freeman, Miss Leanna, as well as Adrika Fulford, that we were bonded, you know, and we were really all dedicated to this work.
Yeah, and every time we mention them, I just get little misty because they were they're, you know, you're not supposed to make your colleagues family, but they absolutely were important and integral parts of our work. And I think sometimes when we think about research, we want to take the emotion out of things. But I think in our work and how we've worked together, Maxica, and you can tell me if I'm wrong, we center that. When we're talking about asking people questions and having to like plow through our work, as we are dealing with life, we have taken time to say, okay, we're going to take a pause on this. And if you're doing research advisory boards, if you're doing participatory research, we know that people aren't just robots and that we have a responsibility to respond to, okay, I don't have childcare right now. And so I'm not going to be able to come on, and it's not like a guilt that goes along with that. Or, you know, I'm not feeling well today. We have folks who are on our team who are dealing with illnesses. And so giving space to people to be able to rest. And I think especially for Black people, we often don't give ourselves the space to be able to rest or to feel comfortable asking for it. But I think in this process, and you can tell me if I'm wrong, Maxica, that we have created a with each other to be able to say that to each other, like, I need a moment, I need a little bit of space.
Yes, and normally if you were in an office or it was a real work type thing, you wouldn't be able to do that. You had to keep going on throughout the day. And I think that was the beauty of it. We bounced the ideas off each other because myself being a cancer survivor of stage 3 cancer, I was receiving critical care at the cancer center. And I was privy to some information and medications and different herbs and substitute remedies that other people are not privy to. So I would pass that information along to other people, and it helped some people fight COVID and help them get over a cold. You know, my mother lived and died on and believed the belief of aloe vera and ginger root. They can heal all. And yes, it was through this platform.
Vapor rub.
Yes, and a little Vicks vapor rub.
I'm sorry, medical school. I know we're at a medical school, but we also, have grandmas.
Yes. And I was able to pass that information on to other people. And they passed on some information to me about a vitamin called euthanasia. It helps to cleanse the blood and different things like that. And we were able to, like I said, it was a bond in the family. We were openly sharing this information, and it wasn't harmful. I always tell people, check with your doctor first, but it's been helping me. It's been helping me, thus far. And that's the type of things. And if we weren't feeling well, because I couldn't have my camera on because maybe I just came from treatment that day, or I just didn't feel well that day because I have neuropathy and other medical issues, and I can't get up and be my best at 100%, but I can still listen and participate if you all allow me to. And that's the platform and basis that we had by working on Zoom.
Yeah. And I think that as more organizations are realizing that we have the nonprofit like industrial complex has really not really engage people with lived experience or do it in a way that doesn't allow them to show up as their authentic self. We're thinking about like, if we're going to have these things, we need to have childcare. One of our first focus groups, Keith, brought in, I asked for 5 people and Keith brought in 30 and they all brought their kids with them. And we provided childcare in our office. 10 more boxes of pizza, and Keith brought in his daughter to help babysit downstairs in our office as we were in the conference room collecting data. It's those moments of saying, okay, one, we are not going to bring people into this space without taking into account how they're going to get here. So making sure that we provided like bus fare or Keith going to get the van and going to pick up people. 2, if I'm getting paid to be in a space, so should people with lived experience. So whether it is a Visa gift card or making sure that, you give people $100 to $200 based on how long they are going to be there. And then always community organizing has taught me a lot, but one of the biggest things is make sure that there's people do not like to come to meetings at noon when there's not food. And I don't know why anyone would have a meeting at noon without food in a shared space. So those are some of the things I think, Max. Are there any other, if you're bringing people into a space with lived experience that you would want to lift up?
Also making sure that, as you say, that they're accommodating and make sure you're respectful of the person. You're not judgmental. Because we can feel it, we can sense it all day, every day, body language, everything from you don't even have to speak sometimes. It is what it is. And just being open and willing to listen to them, because these are the people that are going to help you to get to the solutions that you need.
Absolutely. So in hearing about community, what were, outside of COVID, were there any additional challenges that you think that you all have faced or continuing to face as you all wrap up this project?
Yes, right now is that we don't have enough members. We have enough, it's just myself and Ms. Newman left for the RAB team of grassroots leaders because the other members are deceased. But just finishing with the 2 of us, it's a lot to bounce off, a lot of ideas with just 2 people. We're hashing it out to get to the last little bit. And it's like staying hopeful and prayerful that, we can stay healthy and well enough to continue to work. And also, as different things around here changes with all these masks and mandates and different stuff like that, we wanted to meet one more time in person before it's all over. So keeping that in line, in hindsight, we want to stay healthy and be able to make it to the next meeting and do different things like that. Those are just the things that are just issues right now. Because some of the last little bits of work we needed to be in person to do. There's no way around it. Finishing up the last letters and the findings of our research.
Yeah, because when we met in October, we had to go through, Mexica, can you explain a little bit? And if you can't, it's totally okay. But we had to take all of the questions that you all had asked people. We had to be able to then take that and put it into subgroups. And then take it and break it down even further so that it could be placed into a data point. So you all literally created the questions, interviewed people, also not only interviewed people with lived experience, but also went to frontline workers who are responsible for, so there was a survey sent out to frontline workers who work in our local, our Department of Human Services offices, get that feedback, also bring it into that space and be able to make data point. And Mexica, I want to make it clear, you all have been a part of each part of this process.
Yes, from the beginning to the end, from the creation of the questions. And the last part, that part that you're talking about in October was the mind mapping. We had the mind map and get specific codes and break it down to only, each code could only be 2 words. And we took literally sentences and paragraphs and made them into 2 words for codes, like a barrier like bureaucratic or bureaucracy, a code of lack of childcare or no childcare. We were breaking them down and so much into just those 2 words, and we got a lot of them. When we had the mind map, as you saw, it was like a whole array of over 200 different 2-word phrases that were put there together over thousands and thousands worth of data and information collected from each interview. And we broke them all down just like that. And we were part of this process. And that's interesting. It was real interesting to me because I didn't even know we could even do that until we were face to face doing it. And I'm like, hey, I got the hang of this. I can do this.
Not me. When I realized midway through the day, I said, oh, this is not my ministry.
I told you I was intimidated.
It was great watching you all do it.
I was intimidated, but you want to learn. The more you start and you do it, you're like, hey, I want to continue this. I want to see what it starts out and what it ends up being. Yeah. And it was great to see it.
And I think that you all have done a great job of balancing qualitative data and quantitative, because you can get you can get these data points, you can get these numbers, but there are people behind these numbers and there are stories behind these numbers as well. And so I think with that, I want to talk about some of the work that we're going to be doing soon. And then leave some time for people to ask questions. So I will quickly talk about House Bill 4423, which is a bill that we have been working on this year and comes out of our research advisory board work. 1996 again, worst year ever. Sorry if you were born in 1996, but when it comes to public benefits, worst year ever. Also required anyone who applied for for cash assistance to turn their child support over to the state. So you are someone, in order to qualify for TANF, you have to live in abject poverty. You have to be below 50% of FPL. And so you are required to put your child's, usually father, on child support and then sign that money over to the state so they can be recouped for helping to support you. And so that was one of the things that we were hearing, and Maxica was both hearing in the groups, the one-on-one conversations they were having, as well as what we were hearing in our focus groups 5 years ago. People were saying, I'm not going on TANF. My child's father pays in different ways. He may not be able, he doesn't have a job, but his mom helps out with childcare, or he helps with childcare when I go to work, or he makes sure that the kids have school supplies or shoes or clothing, and getting means that he's going to be put on a child support order that he cannot pay. And I'm just not comfortable doing that. For people who did decide to go ahead and put their child's other parent, custodial parent, on child support, they've been turning this money over to the state. So we've been asking Illinois, our Department of Healthcare and Family Services has our child support enforcement agency within that space. So the people who take care of Medicaid also take care of child support randomly instead of within the Department of Human Services. So what that Colorado has done away with this, and we're like, we can do this here. Surely they're not collecting a lot. Surely it's maybe $1 million or $2 million. These people are living in poverty. How much collected in child support? So we introduced our bill. We're moving our bill along. We're chugging along. Mexico comes and testifies. Republicans speak to the bill and say, this is a great bill. We get unanimous support in committee, and on the floor is unanimous House. We get to the Senate and we come to a screeching halt. What happened? Turns out HFS collecting $43 million in child support on behalf of these families. How much have they been giving back to them, Mexico?
That low and behold number is only about 20% of that.
No, 2%.
2%.
2 million.
2 million. 2% of that amount.
2 million. So 43 million collected, and they've been providing families back who are living in abject poverty. Of that back. They've been splitting it between, and so 1996 allows this. 2/3 goes back to the feds, 1/3 the state gets to keep, and they get to do whatever they want with it. And so they've been using, from our understanding and looking at years past, we think it's upward $500 million have been collected in child support for these families, for these children, and most of it has been retained by the feds in the state. And so we are hopeful. Our legislative session ended on 6/15. This was not one of the things that passed. We were able to get out of the House unanimously, but we got stuck in the Senate. And so we're going to continue working on it. Our hope is to continue working. So we've been working with Heartland on this and some community organizations that work with fathers. One of my colleagues over at talked about going to get his hair cut and was talking about this bill, and his barber was like, oh yeah, that's happening to my child's mother. Like, that's happening support, and my child's mother doesn't see it, and she could really use it. And that's where we're at. Families are paying this child support, and they get onto this public benefit because it's their last hope. And that's, yeah. So we will be continuing to work on this. We will be continuing to have conversation. We're ringing the alarm at the federal level as well. Our US Rep Danny Davis, I believe, has a piece of legislation out there to remove the collection of child support, the recoupment. But we're going to continue working on the state level, and I believe other states are taking this on as a process, as a project as well. But I want to say thank you, Mexico, for coming today, and for all of you all. If anyone has any questions, doing participatory research, like Mexico says, is an opportunity to hear from people with lived experience and to let them drive the bus on this. Folks have not only the information from a space of like educational, but they also have lived experience, and that should be valued when we're thinking about doing research projects. And these research projects shouldn't just go on a shelf. They should lead to policy changes and shifts and tearing down systems and building new ones up. And with that, I will open it up for questions.
Thank you so much, Naya and Mexica. I commend the amazing work that you both are doing. I love that you are centering individuals and really amplifying their voices by allowing them to steal your words, drive the bus. I think that's really important. A lot of the people that write the policies and make the policies don't look like the people that actually benefit from them. So at this point, we have about 10 minutes or so to engage in discussion. So please, if anyone has questions, drop them in the chat and I will be sure to ask your question. I will start. So Mexica, the COIN Act, I am very, very impressed. And I'm just curious to know if there are other states who have implemented similar acts, or if you have interest in sort of spearheading this effort across the country and other states.
Other states are gathering. I'm glad you asked that question. We just did a panel, Naya, myself, and Wayne from Chicago Coalition for the Homeless in November last year. They're on a federal level. A lot of other states, great deal of them, They want to know how we did what we did and how they can do the same. So it's not just something just sitting on the wayside. A lot of people in different states want to participate and do it. And like I said, the best way is to put those with experience at the table, let them talk to you about what the issues are in your specific state, and go back and make sure all information, focus groups, data collected is put together in a bill as Naya has put it together. And she goes and advocates and fights for us. And we go back up with our lobbying and our testimonies, because those are the steps. Those are the measurements for you all to do that. But there are other states that want to do the same thing. And it can be done, and it will.
Yeah. And if I could just quickly add on, everything Mexico said is right on. And also CDPP, which is a national organization, they are definitely the folks to tap into. And when folks are thinking about doing TANF legislation, like they just have this consortium of information on state and policies and how to get around policies and leadership when folks are thinking about this work.
Awesome. I'm here in North Carolina, and I mean, clearly across the country we could use this, but our state is in dire need of something like this. So I plan to stay connected with you both. Let's hear from others. Does anyone have questions or just general comments or thoughts for our presenters? And again, just drop your statement or question in the chat, please.
And I just wanted to add that there's always so many stereotypes for those individuals who are under TANF, that TANF recipients they just want the money and want to sit around and do nothing. I have a lot of education. I was told that I had to fight for my disability. And they took some of the hours because I worked as self-employed and I didn't know to file it on the taxes a certain way and pay the taxes. So they told me I wasn't disabled because of my education. And then when I got on TANF, they were like, well, you can go back to school and possibly get another trade. So, but my doctor deemed me permanently disabled from the neuropathy, and there's no cure for it. I can pass out at any given time if I'm walking. It's like big glitches in my brain. So therefore I cannot work in the workforce. But I didn't let that discourage me. I was hurt, and I've been working on my own since I was 12 years old. My parents started us off working very early. And we always had an education. I was my parents' youngest to graduate. I graduated from high school at 16. And I did get my associate's degree by the time I was 19. And I didn't go back because I had a child like 6 or 7 months later once I got the associate's degree. But I always worked. I always held a job, and I worked full time, sometimes 2-3 jobs at one time. And before I was disabled and had to go back kind of, I had a clock still left, even after having, at the point in time, a 16-year-old child and 3 minor babies. And I have graduated from college with my bachelor's degree in 2019. And I just recently graduated in November with my master's degree. And I just want to make sure you all know there are no stigmas and barriers to the individuals on TANF. We're just trying to look for a way to make a positive change, to become self-sufficient and self-reliant. If we're given that chance and opportunity, we can do that. We can make a difference. We can leave that legacy, even if it's education for our children. And we can make sure that our children, don't have to be low income. Let them know education is continuous, and there is no limit to what you can learn. And I left that legacy for my children. It wasn't that I wanted to sit on TANF and be lazy and do nothing, but I had worked from the age of 12 all the way up to 36 consistently, 2 or 3 jobs. So no, I'm not lazy. I don't just want these few little dollars I'm getting. I'm appreciative of them, but I'll be keeping real and truthful with you. And it does help with my kids, but I think there could be more, that child support, all of it going to my kids, that would be instrumental because they grow out of stuff back to back. I have a 15-year-old, a 13-year-old, and a 12-year-old, and they're always growing. My baby boy went from wearing a size 6.5 in boys' shoes. We just took him shoe shopping last week. He's in an 8.5 in men. So we need that money, that income. It's for the kids. I don't take that money and put it towards me. I put it towards my babies. They go to charter school. I try to give them better education. Like I say, education is the foundation to becoming free of poverty.
Yeah. And if I can just add, in order to qualify for TANF, you have to work. You have to work 30 hours a week. And I think when we're thinking about cash assistance, people are more likely to want to give SNAP or give childcare or give Medicaid, because we believe that poor people don't know how to manage their money. And if you've ever, like, I come from a space where, like, my mother pinched every penny there was. Like, I mean, Abe was like pinched all the time. And we think that you can budget your way out of poverty, but there's only so much that you can get from, only so much blood you can get from a turnip. And so when we think about why our policies are situated in the way they are, one, racism, two, and then two, this idea that poor people don't know how to manage when they manage their money and they know where every dollar is. They know where every penny is. And if that dollar is spent here, then it can't be spent there. And so when we're thinking about the stigma, how it impacts from state to state, it absolutely is situated in a space of racism, but also this idea that we need to give financial literacy to people who are poor. And it's like, I can't manage my way, and I can't become literate in something that I never have access to.
Excellent point. I love it. This really sort of extended the conversation we had in the previous panel discussion, and sort of echoing what you both just said. It's really about leveling the playing field for these children and families, merely providing them with the supports and opportunities needed to, make day-to-day ends meet. Really quickly, Naya, I love that you talked about other types of child support. So child support, in the way that we know it, is financial, but time is an important resource. Sometimes that goes further or means more than the actual monetary amount. So sort of re-envisioning the way that we think about what child support is and what it looks like for families.
Absolutely. When mothers talk about community, or when families talk about community, and you're talking about, dad is able to keep the child from this time to this time so that mom can go and do this, and mom has a child from this time to that time, and like creating community. So maybe paternal grandmother is doing this thing, maternal grandmother or aunt, and all of these people coming together. We know that the more people who are engaged in a child's life, the more successful that child will end up, because they will have I know it's cliche, but it absolutely is a village. And so the state has decided that it needs to be monetary. When mom or dad is saying, no, this is the best way for us. And we know that the data says that Black fathers are involved in their children more so than other ethnicities and races. And so this barrier that we've created with the destruction of public benefits, it was supposed to bring the family back together. But we're finding is that it's actually more harmful, because it is creating a rift when I need $549 from TANF, but if I need that money, that means I have to put you on child support, and you may end up in jail and may lose your license and your ability to work and come back into the community and find housing. And like, what kind of rift does that cause for not only the parents, but the child with the non-custodial parent? It's those things that we're thinking about.
So many big problems to solve. Yes. And just bringing it full circle. Bringing it full circle, again, I can't stress enough. We really need to continue to amplify the voices of the individuals and families that could best use these resources, and give them voice. And so I encourage each of you in your respective units and communities to do more of that. Thank you so much again, Naya and Maxica.
Thank you, Nina.
We really appreciate you.
Awesome. Thank you all for allowing us the opportunity to be here today. It has been amazing. Thank you.
Yes, indeed. Thank you all so much for listening.
Of course. So at this time, you can leave the room and we'll go back to the larger group. And I hope you all enjoy the rest of the conference.